Good evening, guys. This is usmlavideos.net. I request you to visit my website at www.usmlavideos.net for more videos, and please leave comments on my videos. Today I would like to discuss a few points on intrauterine and contraceptive devices. You see, IUDs are not that often used in the United States of America, but around the world they are the most commonly used reversible contraceptive method. In the United States, however, only less than 1% of people, 1% of women use this contraceptive. Now, let me give you a few points, just like basic facts. IUDs are two kinds. Number one, metallic. Number two, hormonal. Metallic IUD is copper T380, whereas hormonal IUDs, there are two kinds. Number one, progestasert, it contains progesterone, and number two, Mirena, it contains levonorgestrel. So basically there are three IUDs. And this evening I want to just discuss the most important points regarding IUDs that you come across in USMLE. First of all, what are the main side effects of IUDs? IUDs, they change the menstrual bleeding. You see, copper IUD, it increases the bleeding, whereas hormonal IUDs, they decrease the bleeding. I will repeat this point again and again because it has a therapeutic benefit, because we use hormonal IUDs in the treatment of dysmenorrhea. Because hormonal IUDs, for example, progestasert or Mirena, they decrease the vaginal bleeding by almost by half. And the second important point you need to remember is which IUD is effective as the post-coital or emergency contraceptive. The answer is copper device. Only copper device can you use as emergency post-coital thing. So basically there are two important IUDs, and you also need to remember the mechanism of action. The mechanism of action of copper IUDs is to produce an inflammatory reaction, and that inflammatory reaction brings a lot of leukocytes into the area, and the leukocytes, by means of phagocytosis, they destroy the spermatozoa. That is the mechanism of action of copper IUDs. Whereas hormonal IUDs, they thickens the cervical mucosa, progestasert and levonorgestrel. When they thicken the cervical mucosa, they decrease the motility of sperms. So that is the mechanism of action of these two important IUDs. Now, let us talk about a few things about non-contraceptive benefits of IUDs. As I mentioned earlier, levonorgestrel IUD, it decreases menstrual flow. So in a woman who has endometriosis or adenomyosis or fibroids, if she is suffering from vaginal bleeding, in those cases you can actually use a progesterone or levonorgestrel IUD. Now, what are the important side effects? You can, or let me say, like risks. The most important risks you need to remember are ectopic pregnancy, PID, and septic abortion. 50% is the rate for septic abortion, and you need to remember that point very, very well. And the most common side effects, however, are just cramping and bleeding. You can use NSAIDs to reduce the cramping, and the bleeding also it decreases. The expulsion rates are up to 10% within the first year of use, and as I mentioned earlier, guys, the most important side effect is spontaneous abortion. That's a very important thing you need to remember. The spontaneous abortion happens, and it led to massive cases of litigations so far. So spontaneous abortion, remember that. And now, what is the relationship between ectopic pregnancy and IUDs? You see, copper IUDs, they protect against ectopic pregnancy. Only progesterone IUDs, they increase the risk. So remember the difference. Copper IUDs, they protect against ectopic pregnancy, whereas progesterone IUDs, they increases the risk. Now let me ask you a question. Which infection is more commonly seen on pap smear of IUD users? If you take a pap smear from an IUD user, that particular infection is very common. What is it? Actinomyces. Remember that, actinomyces. And if you find it, you need to treat it with doxycycline. So basically, guys, we have seen the side effects, the mechanism of action, the uses. Now, the failure rates. The perfect use, if the woman just checks her strings every day, and then T380A has a failure rate of 0.6 pregnancies per 100 woman years, whereas 0.8 for a typical use. That means most people do not use it perfectly. So average failure rate is 0.8 for typical use. And as I said earlier, the major risks are PID, ectopic pregnancy, spontaneous abortion, uterine perforation, and expulsion. Now, let me talk a few minutes about the lifespan. IUDs differ in their lifespan. For example, copper T380A has 10 years, whereas levonorgestrel or Mirena, its lifespan is only 5 years. So remember that. Copper 10 years, whereas Mirena 5 years. Now, let me just recap the most important points. Or let me ask you like this. What is the main non-contraceptive benefit of levonorgestrel IUD? It reduces menstrual blood flow and it relieves menorrhagia. That is the main thing. Now, a case studies. A patient came to emergency room. She is complaining of abdominal pain, abdominal rigidity. On physical examination, she has tenderness all over. And history reveals that she has an IUD in her uterus. What is your diagnosis? The diagnosis is uterine perforation. Anytime a woman comes with abdominal pain and if she has an IUD, that means she has uterine perforation and as a result some infection. That is the most common side effect of IUD users in the emergency room, that is infection, salpingitis or endometritis or peritonitis has happened. So you need to remember that point. And also, what would you do? You need to remove the IUD, start the woman on antibiotics, and use a Kelly clamp and remove the IUD immediately. That's the most important thing you need to do. Now, absolute contraindications: pregnancy, acute pelvic inflammatory disease, and anatomic abnormality of uterus, unexplained uterine bleeding, acute liver disease. If the patient has acute liver disease, and then those times you should not use an IUD. So guys, those are the important points, and if you know anything more, please post on my blog, and so that others can learn and prepare well for USMLE exam, and visit for more videos at www.usmlevideos.net. That is www.usmlevideos.net. And thank you. You have a blessed day.